Welcome back to Stop Feeling Like Shit. And I'm your host, Daniela Korth, with Dr. Buzz today.
Hey there.
And today we're going to talk about something that's really important. It's what happens to your body during cancer treatment, like chemo and radiation. And how can we use functional medicine to help survivors not only feel better, but also lower the chances of cancer coming back?
Yeah.
And so, this is really a great topic because I'm on TikTok, which and I got on TikTok because, my hair was falling out and all this other stuff. And I've met so many people on TikTok where they have hair loss from all types of issues, whether it be stress, autoimmune issues, or they have cancer and they're going through chemo. And one of the questions that I ended up getting from one of my friends on TikTok was, "Hey, listen, I just finished chemo. I feel like shit. Like,
Yeah.
I feel like everything is just like broken down. I'm tired. I'm exhausted. Like, is there anything that can help me?" And I was
Yeah.
like, "You know what?" She goes, "That's what I want you to talk about." And I said, "I can do that for you." So, I mean, the one thing that I know is that if you're going through chemo, it kills everything, right?
Yeah. So chemotherapy, it kills all cells, but the thought behind it is it kills the faster growing cells. They die at a faster rate. So you're trying to kill off the cancer cells before you kill off all the cells.
Right.
So, and like breast cancer is probably one that's very common. And, that therapy is very effective,
Mhm.
but there are residual effects,
Right.
and typically what we see is there's three major body systems that are hit hard. The first one's the adrenal glands. Those are small little glands that sit on top of your kidneys, but they control your neuroendocrine system and your hormonal system. So typically after chemo, those are hit really hard, and that's why their hormones are really messed up afterwards. And your hormones affect your brain chemistry, they affect your libido, and lots of other things. So it's really important to test those once you're done with the chemo. And if the test will show you what kind of state they're in, but we typically see that they're burnt out from the chemo,
Mhm.
which means they're not producing the sex hormones like they're supposed to. And more importantly, we also see really elevated cortisol levels from this. And cortisol is very catabolic,
Mm.
which means breaks tissue down. So that's why these people typically will have lots of joint pain and other pain too, because their cortisol levels are so high, and they have difficulty sleeping is another big side effect you see. Um, and the other thing you do got to keep in mind is when that cortisol high, it also takes down your immune system, because when cortisol is high, your body's immune system drops, which is not good if you're trying to prevent cancer from coming back. So anyone who's gone through chemo, I strongly recommend getting an adrenal test done to see what state those adrenal glands are in, because that controls your hormonal and your immune system. And if there's issues, that's something that we can correct, via supplementation and diet.
Right.
So very important.
And when you say, maybe they don't know what an adrenal test is
It's a
or
spit test. So
okay.
basically, we send it right to their house. They do it in the convenience of their house. They send it right to the lab. We typically get the result back in a couple of weeks. And the vast majority of our patients, we do telemedicine at this point. So we do a Zoom call. We show them the test result and come up with a protocol from there if there's issues.
Okay.
But
Eh,
almost every person that has been through chemo, because it's so stressful, it just burns those adrenals out. And typically, what we see is very high cortisol, very low immune system function, very low hormonal function.
okay. And another comment was question is, does insurance pay for these things?
Unfortunately, this is considered, all insurance works the same way. It's kind of like you have car insurance, right?
Yep.
So your car insurance, if you have something catastrophic in nature, like you crash your car, your insurance covers it.
Mm.
But they consider this more of a maintenance item. So just like your car insurance wouldn't replace the tires on your car if they go bald, they won't cover these maintenance tests. But they'll pay if your cancer comes back, they'll pay for it because that's catastrophic. But they won't pay to prevent it.
Right.
So unfortunately, it's not. But it's very affordable. You're a few $100.
Yeah. Okay. And are the adrenals the only thing that is affected by the chemo, or is it other things?
There's other things, unfortunately,
Yeah.
but we start there. The other thing we see is you have this thing called your microbiome, and the majority of the cells in your body live in your microbiome.
Hmm.
But unfortunately, chemo poisons the microbiome,
Right.
and your microbiome produces Number one, it's very important for digestion of food and vitamins and supplements. And what we typically see is you end up getting infections because the normal bacteria die off. You end up getting parasites and infections because of this. And it's important to realize the majority of people with microbiome issues don't have gut issues, because you might
Right.
be listening and say, well, my gut's fine. I go to the bathroom regularly. I don't have heartburn, so I don't have gut issues. 80% of people that have microbiome issues have no symptoms whatsoever.
Yep.
The other thing you got to keep in mind with the microbiome is the microbiome is responsible for serotonin and dopamine, your feel good hormones. So if your microbiome is messed up, it messes up serotonin and dopamine, which can cause you to have depression, not feel good, all of these other things. So I would recommend also, because of that, basically it's like dropping a bomb. Chemo is like dropping a bomb on your microbiome. It kills everything.
Right.
Um, Cancer cells, which is important, but it also kills good cells.
Yeah.
So that's once again another test we ship to their house. It's a PCR stool test, so they kind of poop in a box,
Yep.
and well, not literally, but you know what I'm saying.
Yeah.
It's a poop sample. They send it into the lab, and the same thing. That'll give us a report back of what's going on with the microbiome. Are the good bacteria still there? Or did they get wiped out with the chemo? Um, because the good bacteria are gone, did bad bacteria now replace them, and are they wreaking havoc on your gut?
Yep.
And this is not only essential for mental health, but for the ability to digest food and vitamins, which is good to prevent the cancer from coming back. And also, your primary immune system layer is in your gut.
Mm-hmm.
And if that's wiped out, once again, not good for oxidative stress, which changes DNA, which leads to more cancer. So, definitely very important to test the gut also.
Okay. So my friend, she was saying she was going to go get her hormones checked out first, right?
You would
Do
always
blood
do your
work.
adrenals first, because your adrenal glands are what run your hormonal system.
Mm-hmm.
So if you went through chemo and now you have no testosterone or no estrogen, number one, you have to be careful with some type of cancers, because if you start taking bioidentical hormones afterwards, you really got to go to someone who knows what they're doing, because if those aren't done properly,
Yeah.
they could actually increase your chance of having cancer. So I would not recommend that. My recommendation is get your own system functioning properly first.
Right.
And if you fix your adrenals, you'll produce whatever you're naturally supposed to produce to testosterone and estrogen wise.
Okay.
So that's a more logical approach.
All right.
So get your body functioning 100% first. And then if we're still not happy, then we can talk about doing bioidenticals. But anyone, and particularly with cancer, why not get your body fixed first instead of just taking outside substances and putting them in there?
Because they don't know, I don't think,
Well, their
so they're
hormones
not
are probably
aware.
messed up because their
Yeah.
adrenals are messed up.
Right.
So we can put a band-aid of taking bioidentical hormones,
Yeah.
which I wouldn't advise them. And if you're going to do that, you got to go someone who really knows what they're doing. Unfortunately, I see more and more clinics opening up that are like, we do hormones. Hormones is very complicated to do, especially in cases like this. Um, Typically, we won't even put someone on hormones if they don't do adrenals first, and we like them to be cancer free for 5 years. And we've literally treat thousands of patients every month.
Right.
We have tons of experience. So I would advise against that. Get your own body functioning well first. 99% of the time, fixing your adrenals, your hormones are going to be fine.
Yep. All right. So you heard it. If you're listening to this episode today and you went through chemo, and or maybe you are cancer free but you still feel like shit, then what Dr. Buzz is saying, he highly suggests doing functional medicine testing, because that's what this is.
Yes.
And it's the adrenal test for sure to check your cortisol levels,
And
if
microbiome.
anything. And then also the GI map, which tests your microbiome.
And you do these right at your house. You don't even
Yeah.
have to go to the doctor's office. Basically, we do a little quick consult on the phone. I don't even charge for that, just to kind of talk through it,
Yep.
do a little questionnaire, and then we ship the test right to your house and you do it. So it's very, very easy to do.
It is. And we have done these tests before. And I have to say, it's amazing what you can find out about yourself and why you feel like shit. And then how you heal yourself in such a short period of time.
Yeah. And the most important part of that is not only to feel better, but to prevent the relapse risk.
Yeah.
Because when you don't fix adrenals and you don't fix gut, your immune system's compromised.
Mm-hmm.
And if anything, when you're cancer free, you really want that immune system functioning at 100%.
Right. You want to be
And it
strong.
won't be if your adrenals are messed up, if you have microbiome issues.
Yep. Anything else you'd like to tell him?
No, I think
Okay.
that's a great start, though.
It is. If you have any questions about what Dr. Buzz is talking about, we would love to hear from you. You can always just reach out to me or comment, and we will get right back to you. But this was a great little short episode about that. I'm excited to share this with everyone. So until we meet again, bye.
Bye.